I am Lani Bebs Cravicilias from BSN 212A of Group 2. And today I will perform the perineal flushing with turn demonstration. So the purpose of this procedure are to remove normal perineal secretions and others, of course to promote client's comfort and to prevent infection or contamination from the rectum. We perform this procedure to patients in labor, postpartum, comatose, diabetic with indwelling catheter, and those with gynecological perineal repair. So prior to the procedure, we must ensure that the equipment we need are present to save us time and effort. So the equipment we need are clean gloves, sterile water, container filled with warm water, our forceps, cotton balls that are soaked in cleansed solution, dry cotton balls, our antiseptic, alcohol, 2 kidney basin, and if necessary, our perineal pad, bed pan, our draw sheet, and our documentation. So next, I'm going to perform hand hygiene as universal precaution. We then explain the treatment to the patient if that comatose or mentally retarded, and this is done to let the patient understand the procedure and to gain patient's cooperation. So good day, ma'am. I am Lani Bebs, your student nurse for today. So may I have your wristband po? Okay, can you state your complete name? How about your birthday?
July 16, 2004.
Okay, thank you. So today, ma'am, I am going to perform the perineal flushing. So I'll be going to clean your perineum starting from your vagina down to your anus. So this procedure, ma'am, promotes hygienic care and thus prevent infection and skin or irritation in your private area, and it also removes odors that are present. So if you may feel uneasiness, ma'am, and be uncomfortable, feel free to say okay. Okay, so you don't have to worry also, ma'am, as I have drawn the curtains and closed the door for your privacy. And later on the procedure, I will only expose the area that will be clean, and the rest will remain covered. Okay. Okay. So do you have any question prior to the procedure, ma'am? Okay, thank you. So it is really important to provide clients privacy by locking the doors and drawing on the curtains. Next, we have to wear our glove for infection protocol. After that, we now position our patient and dorsal recumbent. Ma'am, can you flex your knees? Okay, thank you. This provides patients comfort. Now, we drape the patient, exposing only areas that will be cleansed because minimum exposure lessens the patient's embarrassment. So, ma'am, I'm going to expose your private area po, okay? And then we place a rubber sheet or draw sheet and bedpan under the patient's buttocks. So, ma'am, can you lift your buttocks for me for a while, please? Okay, thank you. This method prevents the bed on becoming soiled. After that, we inspect the perineum and then flash warm water. Note for any particular areas that has the presence of inflammation, swelling, excessive discharge, or secretions, and any presence of odor. And we use warm water to prevent chilling and soften or dissolve blood clots. Then we get 7 cotton balls that are soaked in cleansed solution using pick up forceps to maintain its sterility. Okay, we now then cleanses the external genitalia starting from the midline symphysis pubis down to the anus. So remember never to trace stroke to prevent contamination of the area. Then discard the cotton balls. And with the second cotton balls, clean starting from the mons pubis in figure of 7 by way of external labium towards the anus. So external from here down the anus. And on the opposite side, using another cotton balls. So after that, we do this because secretions on the that tend to collect around the labia minora facilitate bacterial growth. And the fourth cotton balls, clean starting from the mons pubis of figure of 7 by way of internal labium towards the anus. So from here up to here, discard another cotton balls on the other side. And with another cotton balls, cleans the groin starting from the groin going up to the thigh. Discard it with the opposite side with another cotton ball. Okay, so after that, flush the perineum thoroughly with the sterile water. And using a dry cotton ball, we dry the perineum with the same stroke we used earlier. So we do this, thus moisture supports the growth of many microorganisms. So start in the midline symphysis pubis down to the anus. Discard. On the external, on the labia minora down to the anus. On the opposite side, using another cotton ball. And the labia minora. With another cotton ball for the opposite side. And for the groin. Up to the thigh. We now remove the bedpan gently. And let the patient turn to this side. Turn your side po. Okay, so if necessary, take one cotton ball and clean the other side of the buttocks and on the other side also with another cotton balls. This is to provide clients comfort. Okay, so start from here to the anus, guard, and on the other side. You now then turn the patient on her back and make her comfortable. Ma'am, can you turn back po? Okay, so we then spray an antiseptic as needed to promote healing. After that, we put the perineal pad with an up-down motion as needed to promote the contamination of to prevent the contamination of vagina and urethra from the anal area. Okay, after that, we do the aftercare on the patient and on the materials used. Ma'am, you can now relax your right. And we remove our glove. So how are you feeling, ma'am? After removing the glove, we perform hand hygiene. We now then document everything that we have done to the patient, any unusual findings such as redness, excoriation, skin breakdowns, discharges or drainage, and any localized of areas of tenderness. For documentation, it is that the procedure was done properly and it means of communication. And so I guess that's the end of my return demonstration. Thank you.